Good morning, everyone. Okay, I'm sitting out on the back deck because it is super nice out, and it's actually like cool enough that I put, a long sleeve tee on. That's an Office reference. I don't know if anyone catches that. If you do, emoji of some type. But I had 3 questions that one book copies, and I have Tina Payne Bryson's book here. So Dr. Tina Payne Bryson, The Bottom Line for Baby, giving away 3 more copies today. If you want a chance to win tomorrow, go to my Instagram stories and there'll be another question opportunity and you can ask questions. Here's the questions for today. Let's see, I gotta go back through them. I already announced the winners on my Instagram stories, but I actually don't remember what in particular the questions were. Okay, the first question is getting my 3-year-old to poop on the toilet. Now this is a tough one. Potty training is a huge deal that adds a lot of stress and frustration for a lot of families. And if you feel that way, a thumbs up emoji or a yes or something like that. 3-year-olds pooping on the potty is probably about the hardest part. Most kids will pee and poop on the potty separately in terms of learning it. And so the best way to approach this is to give plenty of opportunities. If you know, okay, my toddler always poops after lunchtime, or they poop between lunchtime and nap time, or they poop between, after dinner and bedtime, then give them opportunities at that time of day to sit on the potty. And what you can do is give them some incentive. Now, sticker charts work well. Actually, if you go to drb.show/sticker chart, there's a sticker chart there that I think works pretty darn well. I'm going to take this back off. But I think for a lot of families, you might be able to hear the garbage men picking up the garbage right now. For a lot of families, they are trying to deal with actually, I don't even remember what I was saying. I totally lost my train of thought. Sticker charts work well, drb.show/sticker, but sometimes the sticker charts won't work so well for pooping, especially if they've ever had constipation or trouble where they seem like they don't want to poop on demand, or you find that they are just refusing to poop, or they want their pull-up, or they ask for a pull-up and then they go hide behind the couch and poop. And so what you can do is incentivize them. 1, make sure their poops are nice and soft, so you can talk to your pediatrician about how to soften up their poops if they're too hard and they have constipation. And then 2 is give them a reason to sit on the potty. It's okay. They're not going to go, to kindergarten and everything like that and scream for their iPad at their kindergarten teacher when they need to poop on the potty. But if you need to help them get over the hurdle of pooping on the potty, just give them an iPad or a phone or a book or whatever you think they would like that would be incentive to sit on the potty to go poop. Let them try that and see if that helps. So basically, you make sure their poop is soft. You put them on the potty when they need to, and it's starting to rain. And my nice laptop here is going to be I'm just going to cover up my laptop. It doesn't seem like it's raining very hard, but I really don't want my laptop to get ruined. Train of thought. Soft poop, put them on the potty at the right time of day, give them an iPad, a tablet, a book, something to incentivize them. You can escalate them. You can start with a book and see if that's enough, and then you can go to tablet. It's raining hard enough that I don't want my papers and stuff to get ruined, or my AirPods. So that would be my advice for getting your 3-year-old to poop on the potty. Now, sometimes they're just not ready, in which case I wouldn't push it. I would just wait until they kind of tell you they're ready in their way. And it's okay to be pee potty trained and poop in your pull-up until you're ready. And, I would just talk to them and not make it a huge ordeal or stress. Okay. What does this say? Should you automatically supplement with alimentum if your first 2 babies needed it? Okay, so alimentum is this really expensive, super hydrolyzed formula that I try and reserve for babies that are super intolerant. I mean, I probably have 2 or 3 babies in an entire calendar year that I suggest alimentum for, because most babies can get by with some parental reassurance, making sure they don't have other issues going on, and trucking through some of our issues with our tummy. But for some babies, alimentum seems to be either what the doctor jumps to or what they end up on because they just can't tolerate anything else without fussiness or blood in the poop or those sort of things. And so if your babies have done that in the past, I don't think that you need to start with alimentum again going forward. I always give babies a chance to prove that they either have an issue or don't have an issue with whatever other kids have struggled with, whether it be formula intolerance, dairy intolerance, soy intolerance, allergies, wetting the bed, all those things. Every kid is different, and most things don't run from kid to kid. And so I wouldn't, and I've seen plenty of babies that, like, the first baby was on alimentum because they were super fussy, and then the rest of the babies were totally fine. Or the first 3 babies were all fine, and then the last one ended up on alimentum. So I don't think that you have to say, because our previous babies did, we can't breastfeed, we can't try a cheaper formula, we can't try a formula that smells less terrible. Because alimentum, like, I walk into the exam room, and I can already tell what formula they're on. Like, I don't even have to ask, what are you feeding the baby, because it has this nice odor. And if you've ever smelled alimentum, comment below, or just give a emoji, because it smells terrible and it's super, super expensive. So my advice would be, avoid it at all costs. Wait until you have to do it to go there. Now the third question is blank. Wait, what was the third question? I don't remember. I said somebody was the winner, but I actually don't think I did it right. Okay, well, the third person, I'll just write back on my stories. So I guess we'll finish early today. Have a great day. Keep up the good work. See you tomorrow. And if you want to win a copy of Dr. Tina Payne Bryson's new book, Bottom Line for Baby, leave a question on my question request, and we'll get you registered. And then if your question gets chosen, you win.